Hi everyone, how you doing? Today, let's look at the aesthetics of an all-on-4 smile. Okay, there's a lot to think about here. Why do some smiles look really good? Why do some smiles look like dentures? They've got zero personality. And if you're going down this route and the aesthetics is important to you, how can we get a smile that fits with you? So my name's Gus, I'm a cosmetic and implant dentist, been doing full arch treatment for a long time, okay? And it's not just all-on-4 stuff, you know, where you're having a full set of teeth on implants. We do a lot of veneer cases, and we do what's called complex restorative, where it's a little bit of implants, a little bit of veneers, you know, all that kind of stuff. But the end goal is to create this amazing smile that our patients are super confident with, and they absolutely love every time they look in the mirror. The first thing that we need to appreciate is that every smile is individual. Now, this is a little bit contrary to, you know, slightly older thinking, where we've got smile design principles, okay? And the principles I'll come on to and I'll touch. I'm not going to go in crazy detail, but I will talk about them in this video, because there are certain guidelines that we should kind of stick to. But then if we're creating a unique smile, we can't just have those guidelines and that's it, because everyone's smile would look exactly the same. So we need to customize a smile for that patient, okay? And when we're looking at all-on-4 specifically, there are certain elements of this treatment that we need to think about, especially around the soft tissues and the lips, okay? So as dentists, and we just deal with teeth, it's really easy to forget about the frame of the smile, which is our lips. But let's start with just generic smile design principles, okay? And this is really kind of the study of what a nice smile would look like. So in the days where, you know, loads of people having veneers, then we would look at the smile and we'd say, okay, look, this is the shape of our lower lip. Okay, and the smile line, i.e. that edge, the bottom edge of the top teeth, should follow the lower lip in the vast majority of cases. Okay, not in every single case, but it works well in the vast majority of cases. And this, as well as the midline, okay, which doesn't need to be in the middle of the face, it can be a little bit left or right, but it must be parallel with the long axis of the face. Okay, these are probably the two most important principles of smile design, because if we get these things in the right place and the length of the teeth, so sorry, three things, then we're going to end up with a pretty natural looking smile. And when we are going through the process of maybe somebody who's looking to have veneers and they want to achieve this perfect looking smile on the magazine cover, you know, that kind of smile, these are the kind of the guidelines that we look at. Then we start building in things like golden proportion, which is the width of the teeth. We start giving the canines a little bit more pointedness. We make them look individual, okay? And these little triangles in between the teeth, okay, these are called the embrasures. And even these should be, you know, a certain way. The embrasure right in the middle is typically smaller, and then we get wider and wider as we go, you know, towards the sides of the smile. And for those people who are looking to have, you know, a beautiful magazine quality smile, this is the kind of the process that we go down. So we have a set of temporary teeth made, which mimics all of these smile design principles, and that's our starting point. Now, if you've watched any of my other videos, you'll know that, you know, I talk a lot about a handcrafted temporary smile. Okay, so we would use something like this as a kind of a starting point, would fit it into the patient's mouth, and then I'd like to customize things specific for that patient. Now, what's really interesting is with all-on-4, a lot of our patients aren't even looking for this. I had a patient recently who said, look, I want my smile to be invisible. I don't want anybody to know that I've had this done. I'm of a certain age, and I want my smile to look appropriate for that age. And the thing is, if we look at his smile to begin with, his teeth don't look bad enough that we need to remove them. He's got a lot of his own teeth. He's not wearing a denture or anything like that. But when we take x-rays, we can see that actually, no, there's a lot of infections around these teeth. A lot of them have been broken down. So it is a reasonable thing to remove all of the teeth and to start again. But we want to keep some of the personality. So if we look at this smile, it's not a perfect smile. Okay, the front teeth are a little bit dominant. Okay, we've got these black triangles between the teeth, which we are going to get rid of. This is going to instantly rejuvenate the smile. However, when he smiles, you do see a lot of tooth here. Okay, and the canine teeth are kind of tucked in. The whole side segment of the teeth is tucked in. This isn't what we would call a classically perfect smile. If we were doing veneers for somebody, we wouldn't give them this smile, but this is the right smile for this patient. Okay, and this is what I really think brings in personality into the appearance of the smile. In this case, what we do, we take digital scans, I send it to my lab, they do what's called a setup, and on this setup I can superimpose the patient's teeth and what temporaries we're going to give this patient. Okay, and you can see on the first iteration the canine teeth are just in the wrong place. The lab hasn't really thought about this, they haven't followed the prescription, so we have a version 2 and a version 3 wherever is needed, and when I'm happy with it, then we have just a temporary denture made. Okay, a classic denture which nobody likes, but this is the part, this is how we do our all-on-4 treatment. Anyway, we also have guides made, okay, and these guides help us position our implants in exactly the right position. So in his case, where everything is just a little bit more narrow, our implants need to be in a little bit more. So it's really important to think about the aesthetics before we even start. Then anyway, implants are in. Okay, this is his smile. Yes, there's a massive transformation and the teeth are looking a little bit denture-y. Okay, but that's just the way things are on the temporary smile. The main thing is the length of the teeth is exactly the same. The arch width is the same. It doesn't look so much like a denture, and we don't want it to be such a transformation from where he was. Okay, and believe it or not, the teeth are not as white as they seem in the photo. It's just that the way our camera flashes are, it just brightens everything up. Now, taking the idea from veneers about smile design and just the appearance of a smile on a photograph is great, especially if we're just doing veneers. Now, one thing that we need to really pay attention to for all-on-4 treatment is the transition line. Okay, so that junction where the natural gums are and the fake gums start, because if we get that wrong and the transition line is visible, the whole treatment is a complete disaster. Okay, so if you're a patient who smiles and you see a lot of gum, okay, that makes all-on-4 treatment incredibly difficult, and we need to think about, how we're going to manage the soft tissues in those situations. However, you may just have a normal smile, but when we remove all of the teeth, we lose bone support up here. And then if we put the teeth in the same position as where they were, sometimes you can get this step, and when you smile, your top lip kind of sits above the teeth. So again, this is obviously something that we really, really want to avoid. And there are techniques to do this. And over the years, we've seen some people who have been other places and had implants placed. And if the implants aren't placed in the correct position, and what's more important is there hasn't been enough what we call bone reduction done. Okay, this is critical. A lot of people don't do enough bone reduction, and if that hasn't been done enough, it makes everything really difficult. It messes up our lip support. It gives us that transition line, which is really obvious to see as well. And this is why sometimes we see patients and they've got these teeth which wrap over their gums, making it impossible to clean. Okay, because what's happening is the dentist is trying to hide this transition line, but in doing so, we end up with the prosthetics wrapping over the gums, making it impossible to clean, which is going to lead to long-term problems. Now, in terms of getting an age-appropriate smile, I kind of touched on this earlier, but one of the key metrics that we need to look at is the length of the upper teeth. Okay, now as we get older, we show less and less top tooth, we show more and more lower tooth. So the amount of tooth that we show has to kind of be age appropriate if that's what the patient wants. If the patient would like something which rejuvenates them a little bit, then we can show more top tooth and a little bit less lower tooth. Ladies will typically show more tooth, upper tooth than men. So we just have to take all of this into account when we are designing our temporaries and getting down to the stage where we're creating this excellent end result. Now, if we're looking to add natural aging to a smile, we have to be kind of clever on how we do this, because it's very rare that somebody wants a really natural looking smile, but we have to add aged appearance to certain things. And what we can do is add tooth wear. Okay, so as we get older, we wear down our teeth. So when we have young teeth, the teeth are more round, they're more curved. But as we get older, if we want to add aging to a smile, we flatten off the edges a little bit. We can also add crack lines and staining to teeth as well. This is all stuff which makes it look more real. To be honest, very, very few patients of ours would want this, but for those patients who do want it, I think it's really important to add it in a nice and natural way. The other thing is it's very rare to have teeth which are perfectly straight as we get older in life. Teeth move during life, and especially the lower front teeth. These teeth are often a little bit crowded, and this is normal. So sometimes we do add a little bit of unevenness, and sometimes we'll make one side of the smile more dominant than the other side. Again, this is adding natural variation because nobody is symmetrical. If we take a photo, we cut it in half, and then we superimpose the left onto the right to make it perfectly symmetrical, you end up with two completely different faces. So following that logic, we can look at the smile and say, look, smiles are not supposed to be perfectly symmetrical, even though the vast majority of the smiles you'll see on my social media, they are symmetrical, because what the patient wants isn't always what is age appropriate. So we have this image in our head what a perfect smile looks like, and it should be symmetrical. And especially if you're spending loads of money and you're going down this process, your mirror is going to get closer and closer, and you're going to become very particular about the left and the right and the sharpness of the canines and a lot of this stuff, which hopefully after 6 months of finishing the treatment you'll just forget about, because it's just really not that important. I mean, I say it's not important. Everybody's different, and we all have different things that we pay more attention to. So if the sharpness of the canines was something that always catches your eye, you're always going to see it until we get it exactly right. Another thing that changes over time is our gum shape. Okay, our teeth will get a little bit longer. We'll get a little bit of recession as we get older, but also these pink triangles in between teeth, these are called papillae, and these will flatten out over time as well. So when we're creating that perfect smile, that magazine quality smile, that's when, we're paying more attention about the papillae, getting those exactly right, getting the thickness and the fullness and the color and the texture of the gums looking really good. So all-on-4 is different to veneers, remember, because with veneers, we're just changing the teeth, whereas all-on-4, we're changing the gums, the lip support, and the teeth all in one. So in this video, I know I'm kind of deep diving into micro details, and micro details are important, but always remember the most important thing is what we call the macro details. And this is when you kind of like unfocus your eye, and if a smile looks pretty good, that's the most important thing. The micro details come in after all the macro details are exactly right. So if the length of the teeth, the midline, the smile line, all of that stuff is the foundations of the great smile that we're looking for. And in my experience, for those people who are thinking about having this done and the aesthetics is important, we need a number of appointments to get it right. We never get it right just in one go. I mean, sometimes we do, and that's great. However, it's really important to spend the time and we create a temporary set of teeth. The patient is able to go home with these, test those out in real life, come back, we can make modifications, and this iterative process helps us get to the end result that we both want. There are really no shortcuts. You'll see on websites that people do digital designs, and they do, they'll put someone else's teeth on your face. That's all great, but you don't get to see how your lips are moving around that set of teeth. There's only one way to really be sure, are we going to get the right aesthetics? And that's by giving a physical temporary set of teeth which you can test drive. So if you're going down this process and all this stuff is important to you, and I appreciate that for the vast majority of people it's not important, ask your clinician, ask your dentist how they ensure that you get the end smile that you want. Are they able to show you photos of different cases and different styles of smiles? And are there limits on the number of reviews that you'll get when it comes to getting the end smile? Because at the end of the day, that's the main thing that the vast majority of my patients are judging me on is the appearance and the feel of that end result. So I hope you enjoyed geeking out over dental aesthetics with me. Until next time, guys, I'll speak to you soon. Take care.